Morning, Judge.
It is good.
Morning, my lady.
Nicole, you may place the matter on record.
Thank you, Judge. Today is Friday, the 25th of March, 2022. We are before the Honorable...
I can't hear you. I don't know your sound. I don't know whether the others could hear you. Just raise your voice, please. Yes.
Thank you, Judge. Today is the 25th of March, 2022. We are before the Honorable Madam Justice Tefo, calling case number I-001 of 2021 in the matter of life Esidimeni Inquest.
Thank you. Good morning, Professor. Good morning.
Good morning, my lady. Good morning.
Good morning, Professor.
Good morning, my lady.
Okay, now he is much better. Mr. Late?
Yes, my lady. Witness is before court for cross-examination by Mr. Pishlela.
Okay, can you all hear him properly? I heard that you had problems.
He had problems. If he just sits a bit forward, he's much more audible.
Okay. Mr. Pishlela, are you ready? Just before we start, can you take the oath again, Nicole?
Thank you, Judge. Please state your full name and surname for the record.
Gregory Ronald Tintinger.
Do you have any objection to taking the prescribed oath?
I do not.
Do you swear that the evidence that you are about to give will be the truth, the whole truth, and nothing but the truth? Please raise your right hand and say, "So help me God."
So help me God.
The witness is sworn in, my lady.
Thank you very much. Mr. Pishlela, are you ready? I don't see Mr. Pishlela here. Mr. Pishlela? Was he at the roll call?
He was, Judge. He confirmed his appearance for the 4 in-person litigants.
Okay, thank you. Mr. Late, can you please try to check what is happening with Mr. Pishlela?
You asked here this morning, my lady. I'll see what
I don't
can
see him here. Just send him a message to tell us what is happening. Maybe he's got connectivity problems. You should have put on a jacket, Doctor. Professor, where is your jacket?
Yes, in trying now to get the new laptop, I took it off, my lady.
Okay, no, that's fine. But it doesn't augur well, especially because now everybody's watching us. You'll get that during, if you're not done, maybe after the tea break. Is it possible to get the jacket while they're still looking for Mr. Pishlela? I don't know, because my worry is if you change your position.
I will get the jacket, my lady.
Okay, please do so.
My lady, I did phone the number I have of Mr. Pishlela, and he doesn't answer the phone. The phone directly goes directly to voicemail.
Okay. Can we then take an adjournment 5-10 minutes. When he's available, you will notify us.
I will do so, my lady.
Okay. Thank you. Professor, we're having a problem in getting hold of Mr. Pihlela. We're therefore taking a short adjournment so that we can check his whereabouts. Once he is there, you will be notified. Thank you.
Okay, thank you, my lady.
Thank you, Nicole. Can you contact the judge? Mr. Pihlela is back. Mr. Pihlela, are you there?
I've just told the witness that we are waiting for Mr. Pihlela. Now he has left his desk. If somebody can alert him that Mr. Pihlela is here. Are you there, Mr. Pihlela? Are you ready?
Yes, my lady. Apologies. My system just reset itself, so I had to start everything from scratch. But I was on before. Would your ladyship prefer to receive feedback regarding the application now, or maybe after this proceedings?
Yes, and I forgot to also ask about Beauty Kekana. Remember also Beauty Kekana?
Yes.
You also have anything? Do you have anything about him? Hair?
Yeah, I think Beauty Kekana, I received confirmation. I think it's at a very advanced stage.
Okay.
Because they were requesting to know.
We can talk about that in the meantime while Mr. Late is checking the witness.
I think Beauty Kekana, they're in the process of appointing a judicial attorney to represent her. And with regard to the others, what has been, I've received confirmation that the matter is with the national office. The only thing that is outstanding is a decision on whether to grant legal aid or not. Now, I've requested that maybe they can give an indication as to when that can be, but unfortunately, that will not be possible. But as it stands, the matter has been escalated from Krugersdorp to our national office. So it's no longer necessary to follow up with Krugersdorp. Now we'll follow up with the national office. But I can confirm that it's receiving attention at the highest possible level within legal aid.
But you can't say as to when you will get the outcome.
No, my lady. At the moment, I cannot say.
But will you just keep on? I don't know whether it will be possible during recess for you to keep on checking, because we need to get this thing done now.
I will follow it up, my lady. I did escalate it.
Even the one of Beauty Kekana, they must just take a decision. It's long now.
No, I think that one, they're in the process of appointing somebody from jury care, because I received communication, I think, on Wednesday, where they wanted to know the dates, when we'll be sitting again. Okay. So I think that is a good indication that they are considering it. They've considered it favorably, without binding myself to that, of course.
Okay, thank you very much, Mr. Pihlela.
Yes, surely.
Professor, you are reminded that you are still under oath. Mr. Pihlela is ready now to cross-examine you. Thank you very much, Mr. Pihlela.
Yes, court pleases, my lady. Good morning, Professor. Tintinja.
Good morning, Advocate Pihlela.
Prof, I'm representing 4 NGOs in this matter. With reference to the opinions that you did, they are relevant to only one, that is Precious Angels, and that is where Mr. Terence Chaba and Mr. Lucky Maseko are concerned. Now, without much further ado, Prof, I just want to take you through your report, your opinion rather. Now, if you recall, it's on page 2913. You have the report in front of you, Prof.
I do not at the moment.
My lady, the professor doesn't have access to case lines. If they can, somebody can just throw the report on the screen, please.
Sacha, where are you, Ms. Stevenson? Can anybody assist us in this regard without any waste of time?
My lady, can the page number just be repeated, please?
2913.
Is the page on the screen, my lady?
Yes, I see, although, yes. Prof,
Thank you.
can you
I
read?
can't see.
Yes.
I think
I
if
can
the
see
Prof can see, it's fine.
Come again, Prof, Professor?
I can see the report on the screen, my lady.
Okay. Mr. Peter?
Thank you, my lady. Prof, the first thing I wanted to deal with reference to your report is in paragraph 4, you note, if you can just go to paragraph 4, you make reference to the date of the 23rd of June 2016. And you know that on the day of this transfer,
I don't know whether your position, there's something is not right. You're not going to.
am I breaking my head?
Yes, please try that. Try again.
Yes. We are talking about paragraph 4, Prof. If you can just look at paragraph 4.
I see it, Advocate Bixlela.
Now, it seems that you are convinced by the progress notes that were recorded by Life Esidimeni that the condition of the user was satisfactory and that he was well nourished, correct?
Correct, that is what was stated in the notes from Life Esidimeni.
Yes, but you seem to have accepted this as being a fact, because I see that it permeates much of your report. You make a comparison in terms of the general health condition of the user at the time, of Mr. Chaba at the time.
That is correct, Advocate. So there was corroborating information. The patient's weight was recorded, and there was other information regarding the patient's condition that was recorded in the notes.
Yes. Now, did it record his weight prior to, on the day that he left Life Esidimeni?
His weight was recorded in the notes as, I think, at 63 kilograms.
But I see that you have not indicated that in this opinion, which is when I compare it to the one of Mr. Maseko, where you have recorded his weight, his progression, his weight on the 23rd and so on.
That is correct. The weight, I did not include the number on this report. but his weight was 63 kilograms according to the notes.
Okay. Prof. Now, I'm going to refer you to a statement by Ms. Ethel Mube. The statement can be found or the relevant page that I want you to look at is on page 1467 to 1468. Now, while they are busy uploading that, what do you understand by the words well-nourished as they were reflected in the progress notes?
I can't, speak for the person who wrote the notes, but in my opinion, if someone is clearly emaciated and severely malnourished, that would be obvious to the person who wrote the notes. So it seems that if they, wrote well-nourished, then it was not the case that there were obvious signs of severe emaciation or wasting. So that would be my opinion.
So in essence, you don't know what the person meant by well-nourished. You can only assume or make certain deductions which are really uninformed by any evidence that was before you at the time. You made the assumption that that meant that he was in good health and he was healthy and his weight was fine and so on.
Yes, so I looked at the written notes. That was the statements at the time that the patient left Life Esidimeni. And then I also looked at the other notes that included objective evidence of the patient being in good condition, such as the patient's weight and the vital signs. And there were other information recorded on the in the notes from Life Esidimeni. So I looked at all of those together, and part of that assessment would be the statement that was written by the person who transferred the patient that he was well nourished.
The question by Mr. Pitlela, he's talking about assumptions. Do you agree with that statement?
Yes, I do. I cannot say, precisely what the person who wrote the statement meant by well nourished. That person would have to, state that.
Now, this person who wrote this note, is he a medical doctor or a professional nurse or what?
I did not have access to the information on exactly who wrote the statement and what his or her qualifications are.
So it could have been anyone.
I do not have access to that information.
Yeah, but what I'm saying is, are these terms normally used in the medical profession? I mean, doctors, in my experience, doctors do not write things like well-nourished in their reports. Do you agree?
No, I do not agree. I think doctors and nurses do make those kind of statements and write them in the notes, especially if it's pertinent to the clinical scenario or the clinical setting.
Yes, but with reference to this statement in particular, we don't know the qualifications of that person. We don't know if that person is qualified to make any physical assessment of a patient, correct?
Well, I do not know the qualifications of that person, but the implication for me was that it is someone who has some medical training, because those are terms that we do use in our notes.
Yes, but in this instance, we do not know. You cannot say for certain that this person actually knows what they are doing.
As I said, I do not know the qualification.
Just a second, Doctor. Just a second. Mr. van Bergen.
Thank you, my lady. My lady, my apologies to Mr. Pishlela for interrupting his cross-examination, but I have a difficulty with his statement that he makes that we do not know who made his statement. That is incorrect. If one goes to page 2805 on case lines,
Yes.
that is a report by the medical officer, Dr. Kota, on 18 May 2016.
This name, I can't see it properly. What is the spelling of this?
I believe it is Khota, my lady.
Kota. Okay.
Kota. Thank you, my lady.
My lady, may the witness step aside because now
Yes,
we're
just a second, Mr. Pishlela. Yes, I could have forgotten to do that. Professor, you may step aside, please. As we do the yes. Just step aside, you will be called shortly. Yes, continue, Mr. van Bergen.
Thank you, my lady. This is the examination report on transfer, in which the weight, for example, of 63 kilograms is recorded. The vital signs that the professor referred to are recorded. So the statement that we do not know who gave this information is incorrect.
Mr. Pishlela?
My lady, we are talking about the progress notes. We are not talking about this assessment that was made here. What is written on this document is not the same. It's not the same that is reflected on the progress note. If the Learned Council would refer me to the progress notes, which we are talking about, and then make that submission, then I would be ad idem with him. But now he's referring to a different document which speaks of a different story altogether. I have not come to that issue. I'm dealing with the person who wrote the progress notes upon which the doctor relied. The professor doesn't say, I relied on the fact as contained in this document. He's referring to the progress notes. And those, in my understanding, we have already dealt with them when we dealt with Professor Pinar. And his answer was that he doesn't really have, this does not look like it was done by somebody with medical qualifications. And that is where I'm coming in. Now, if the Land Council wants to posit the same proposition on the basis of the progress notes, then we can get into that.
Mr. van Bergen?
Thank you, my lady. What the professor said is he looked at the written notes, and he also relied on the objective information that was available. And he specifically referred to the weight of 63 kilograms,
yes,
and the vital signs that were recorded. And and he said that was part of the assessment, is the statement by the person who transferred. So if one looks at this document on page 2805, the vital signs are just below his name. The blood pressure 121/89, a pulse rate of 81, temperature of 35.5, respiration rate 18, and his weight 63 kilograms. Nutrition, good. Your ladyship will note it's the 1, 2, 3, 4, fifth line.
Yes, I'm there. That's fine.
Nutrition, good. So this was made by a medical practitioner. It flies in the face of the statement that Mr. Pishlela makes to the witness that we do not know who made this statement. Here is a medical practitioner who recorded on 18 May 2016 that the patient's nutrition was good.
What are you therefore saying? Could it be this medical practitioner who made the note?
Well, I'm not saying that, my lady, but the information
Yes.
on which Professor Tintinger relies is contained in this document.
Yes, I understand that, but from Mr. Pihlela's objection, his point is that he's specifically talking about the note that says the patient was well nourished.
Well, my lady, if I may request Mr. Pihlela just to refer the court to that specific note, the page and where the note appears, so that I can see it in the context in which he...
Yes, because I think he's just Mr. Pihlela?
My lady, I see Advocate Late's hand is up.
Okay, thank you. Mr. Late?
My lady, I wanted to ask the same question as Mr. Van Bergen asked.
Yes.
That Mr. Pihlela must refer to that specific document.
Thank you. Mr. Pihlela, if you may assist us.
My lady, the challenge is I'm referring to what is being written in the statement under what the witness has termed progress notes. Now, he records what basically is found in those progress notes. Now, the challenge that I'm posing to the witness, it is not so much that the information that I'm not saying what has gone before. I'm more concerned about this progress notes, whether they are medical notes, whether it's just a report that was submitted with the patient, or because to say I have not had sight of this document that this person is referring to. But what I've been able to see is documents that seem like a standard form under the letterhead of Life Esidimeni. And those documents to me do not seem to have been completed by somebody by a medical professional. Yes, he might have relied on what has gone before and what was contained where and what. But the reference to the use of these words, because it is not the only occasion that he has used the same words. The same words are also used with reference to Lucky Maseko, Mr. Lucky Maseko. The same exact words are used, the same exact observation is used. So that is where actually I'm going with this.
Yes, but the difficulty is, why don't you ask him a straightforward question for him to explain as to where he got those documents? Because the witness says he referred to objective evidence that is there and all the records that are in the notes. Why don't you just ask the witness to specifically tell us where he got that word? Because now you yourself, you can't even tell us where the word is. Mr. Late, I saw there is just a second.
Anyway.
It's also confusing to the witness. I mean, Mr. Pihlela?
My lady, now the concern that I have, but I'll move away from this question so that we can explore other things. We'll come back to it if needs be.
If the court will allow you to do that, here is a witness who says
the witness where he got this information in particular. Maybe
yes,
that would be
we need to be very careful as to the line of questioning the witness as to where the question is taking us, because the witness says to you he has consulted, he has looked at the documents that were there, and he specifically tabulating those documents to say there was objective evidence. There was this. That's where I picked up all this and then to formulate my opinion. So I don't know what more do you want from him. All right.
That's quite this madam.
Thank you very much. You should just refrain from this line of questioning. Can we call the witness back? Yes, Professor. You may proceed, Mr. Pichel.
Thank you.
That's quite pleasing. Prof, you mentioned that the patient or Mr. Chaba was also observed as being chronically ill.
At the time that he was at the autopsy, are you referring to Advocate Bixler?
Pardon, I did not catch that.
At what point in the report, in my report, are you referring to?
It's in paragraph 5, where you are also mentioning that at the time of his admission to Pretoria West Hospital, it was noted that the patient is chronically ill and he is uncapped with dirty clothes. He has a threatening bed sore right hip.
That is correct. Those were the notes that were documented in the patient's file at the time that he was admitted to Pretoria West Hospital.
Yes. Now, you'll agree with me that chronic illness is a factor when it comes to the issue of weight loss, correct?
Correct.
The document that I'm going to take you to is on page. Before we move to that one, I want us to go look at page 21272. While that page is 272, my lady. While that is being loaded, Prof. So if I were to try and understand the implications of what you've written in your report is that because Mr. Chaba lost a lot of weight, then it meant that somehow he was not fed properly at the NGO. Is that the impression that you are creating?
Advocate, if I may answer that, when I evaluated the patient's records, I was trying to establish a baseline on what the patient's condition was at the time that he left the Life Esidimeni institution. And I wanted to compare that to the findings at the time of his admission to Pretoria West Hospital and the autopsy findings that were in the records. Because it is important, a person should not lose more than 5% of their body weight over 3 months or more than 10% of their body weight over 6 months. So if someone loses more than 5% of their body weight over 3 months, then we need to establish the cause for that, because that cannot be attributed to normal variation. And when I evaluated the records, it was very clear that Mr. Chaba had lost a lot more than 5% of his body weight when I compared his 63 kilogram weight at the time that he left Esidimeni to his weight that was measured at autopsy, which was 46 kilograms. So that is about a 27% change in his weight. And it's very important to then establish the cause for that. The autopsy provided the immediate cause of death, but it did not provide the underlying cause of death. And the underlying cause of death is actually probably more important than the immediate cause of death. And so I was trying to establish whether the underlying cause of death was documented or obvious from the autopsy findings. And the underlying cause of death was not apparent in the autopsy findings for Mr. Chaba. The cause of death was a pneumonia, which is often, very often, the final common pathway for severe debilitating conditions, which could include severe malnutrition or starvation. And so that was the reason that I compared the baseline findings to the autopsy findings. And the autopsy did not reveal the underlying cause for this significant, very significant weight loss that was, documented in the patient's records.
Now, the document that is displayed before you, Prof, it's a statement by the sister, the aunt of the late Terence Chaba, Susan Poshoko. If they can show you page 21274, that is paragraph 8. Paragraph 8. Now, you may read that paragraph, Prof.
All right.
Yes.
Around 2015, I started to notice that Terence's health was deteriorating. He was losing weight, had swollen gums, and could not talk. Terence was also in a wheelchair. When I asked why Terence was in a wheelchair, the staff at Life Esidimeni explained that Terence had attempted to jump the security fence and had fallen. The fall had resulted in an injury to his spinal cord, and that was why he now needed a wheelchair. I was worried about Terence's health and whether he was still receiving the correct medication. Around February 2016, I requested that Terence's medication be reviewed. However, this was not done, as far as I know, and I suspect now that this was due to the users of Life Esidimeni were being moved to other facilities.
Thank you, Prof. Now, as you have testified, Mr. Chaba, according to you, was well taken care of while he was at Life Esidimeni, correct?
That was my impression from the progress notes and from the other notes that were documented by the staff working at Life Esidimeni, correct?
Yes. Now, we see that despite the best possible care that he was being given, in 2015, he was losing weight. You see that?
I see that was written in the paragraph, yes?
Yes, and also, as far as the family knew, he was not in a wheelchair, but now in 2015, he was in a wheelchair. And he had an injury to his spinal cord. That is what was explained to them.
That is what is written in the statement, correct?
You will agree with me that these are important considerations to be had in mind when looking at the question of why he was losing weight so drastically at the time. It is not simply just saying he was not being fed or he did not eat, so therefore that is the reason why his condition is that way.
All right, I can only say that when a person has lost 27% of their body weight over 3 months, that is very abnormal. And we would always try and establish the cause for such a severe degree of weight loss. The causes could include factors such as tuberculosis or malignancy, but none of these were found at the autopsy, which led me to consider that perhaps there was another possibility, such as starvation. And there are two criteria that need to be met in order to consider the possibility of starvation. And the first one is that the patient is emaciated. And it was clear from the autopsy findings that the patient was in an emaciated state. The second criteria to consider starvation as a possibility as a cause of weight loss is that there was no other reasonable cause established, found at autopsy, that could have resulted in this severe degree of weight loss. And the autopsy findings did not show the underlying cause for the significant weight loss between the June 2016 and August 2016.
Prof, I want to take you to a document on page 2854.
2854.
Correct, my lady. From what we know is that Terence was admitted to Pretoria West Hospital on the 8th of August 2016, and this was after he had suffered a seizure. Do you agree with me so far, Prof?
I did not see in the records that he had suffered a seizure, but we can check. I do not recall that specifically at what time he had suffered a seizure.
The document that you refer to, upon which you found entries regarding him being chronically ill, if you had read it in totality, it would have indicated as much. But before we move to that document, let's start here, and then we'll clarify that aspect in a few minutes. Now, doctor, this seems it's a document, it's a lab report. Blood was received on the 10th of August 2016, and these were the findings. Now, when you look at the first part of that report, under chemical pathology, can you maybe just explain to the court what those tests requested were for?
So the test that I see here is labeled as CSF, which is cerebrospinal fluid. So a lumbar puncture must have been performed at the time of admission to Pretoria West Hospital. And the cerebrospinal fluid would have been sent to the laboratory for various investigations, one of which is the CSF glucose concentration, which is printed here as 4.2 millimoles per liter. And I assume that the reason for the lumbar puncture was possibly to exclude a meningitis. There would be other indications of lumbar puncture, but that would certainly be an important one. Then also the cerebrospinal fluid protein concentration is listed here as 0.33 grams per liter, which is within the normal range. And the CSF adenosine deaminase is given as 1.2 units per liter.
Yes, and underneath there is a narration, the CSF-AD activity. Can you explain to the court what it says there?
So adenosine deaminase is a biochemistry test that we sometimes use if we are considering the diagnosis of tuberculosis. But it is not a very accurate, sensitive test when performed on cerebrospinal fluid. So there would be other tests that we would consider if we are wanting to diagnose tuberculous meningitis.
Yes, but here it is recorded that the readings are suggestive of TB, even though the test you're saying is not a very good test, but it still made the suggestion that there might have been TB.
No, Advocate Pixlela. The value was 1.2, and in the explanation below, it says a CSF ADA activity of greater than 6 units per liter is suggestive of TB. However, other conditions such as bacterial or cryptococcal meningitis may also produce elevated ADA levels. But the ADA level in this case was not elevated because it was 1.2 units per liter and not greater than 6 units per liter.
Turn to the next page of that document, Prof.
This is now 2855.
Correct, my lady. Again, there are certain tests that are requested there.
Yes, I see them.
Yes. Can you just indicate to the court what those tests are and what their significance is?
All right. So the sample that was used to perform these tests was, again, the cerebrospinal fluid that had been aspirated during the lumbar puncture. And these are standard tests that we would do on cerebrospinal fluid. And the macroscopic appearance of the fluid, the clarity was clear, it was colorless, and the cell counts were 0 for 3 different types of cells. The polymorphs are white blood cells or neutrophils, and there were none of these were found in the CSF sample of Mr. Chaba. The lymphocyte count was also 0, so there were none of these cells present. Erythrocytes or red blood cells was also 0 per microliter, so these were not present in the CSF of this patient.
Yes. No, keep going, Prof. Want to understand what this report means.
All right. The India ink stain, we were looking for yeasts, encapsulated yeasts. They were not observed. There were no bacteria noted on the gram stain. So that is the CSF is looked at under the microscope, and there were no bacterial organisms observed. And then the other bacterial antigen tests that we would perform when considering a diagnosis of bacterial meningitis, these were all negative, as was the cryptococcal antigen test. It was also negative. So the overall findings of this cerebrospinal fluid evaluation is that there was no evidence of bacterial or cryptococcal meningitis.
What does it mean where it says Streptococcus pneumonia is negative?
Just a second, Mr. Pitlela. This cryptococcal antigen, what are these tests? If you can explain, and also explain the cell count, polymorphs, lymphocytes, and erythrocytes. If you can explain that to us.
All right. The cell counts. So there are normal values for very low values for these cells in the cerebrospinal fluid, and if the number of these cells is increased in the cerebrospinal fluid, that could be an indication of meningitis.
Yes.
So it's an important test to do when considering a diagnosis of meningitis, because often the immune response to meningitis is for these cells to increase in the cerebrospinal fluid.
Mm. And now the cryptococcal antigen test.
So the cryptococcal antigen test is a test that is used to try and identify the presence of cryptococcal organisms in the cerebrospinal fluid.
Mm.
And these were not detected in this patient, which would imply that the patient did not have cryptococcal meningitis.
Okay, you may proceed, Mr. Bittler.
Yes, Prof. And that's where the report ends. But I want to take you through to the same report or a similar one on page 2847, which I think is more comprehensive, because this one doesn't seem like it's complete. From what I can gather, it contains the similar type of information as the one you've been reading to the court, but please continue from where the last one ended. Starting from real-time PCR for tuberculosis.
Okay, real-time PCR for M tuberculosis, or the gene expert test. The PCR result, Mycobacterium tuberculosis complex, was not detected. So this is a very sensitive test that is used to detect the presence of tuberculosis in the cerebrospinal fluid, and this result was negative.
Yeah, but there is a qualifying statement below that.
All right, so this test is part of the assessment. The negative gene expert assay does not conclusively rule out a TB. Please manage according to national guidelines. If the patient is HIV infected, please submit a second sample for TB culture and susceptibility testing. So we would always sample to culture for TB.
I think there was something wrong. I don't know. You broke down, so we couldn't hear what you were saying. If you can just repeat that again, please.
Okay, my lady. The gene expert test was negative, but we would usually submit the sample for culture as well, because that is one of the better ways to try and exclude tuberculosis, is to culture the sample and to detect the growth of Mycobacterium tuberculosis. And that, I assume, that is what was requested for this patient. And the result that I see there is no growth after 2 days, which would be again in keeping with the negative PCR result.
Yes. Now, what does it mean below that when it says this test was rejected?
We can't hear you, Mr. Bittler.
Apologies, my lady. Below that, it says test rejected. Can you explain to the court what it means?
Tests rejected, auramine with TB culture liquid medium, specimen insufficient for tests. So it appears that part of the cerebrospinal fluid sample was used for the test that we have discussed earlier, but there was not sufficient sample to continue with the culture for TB. So I assume that the microbiologists needed a minimum volume of fluid to continue with the further testing, which they may not have had available to them in this case.
So would this mean that they were not entirely satisfied that TB can be completely excluded from as a factor in this instance? Hence, they wanted more cultures. They wanted more samples to test.
Well, it appears that the cultures were not completed because two days is a short time. We normally incubate these samples for a number of weeks. So 2 days would be very short. So we would have preferred to have enough sample to incubate for a number of weeks, to obtain a more definitive result.
So in a sense, that means that TB cannot completely be excluded as a factor with reference to Mr. Chaba, correct?
So we would rely on multiple, clinical and laboratory and radiologic information when considering the diagnosis of tuberculosis. The clinical context would be very important. We would consider radiologic investigations such as an MRI of the brain, and then we would use complementary culture results to try and confirm the diagnosis. But sometimes we don't get a definitive answer from the microbiological tests.
So do you confirm what I'm saying, Prof? Because it seems like you want to confirm it, but you are taking the more diplomatic route. It's simple. It was not completely eliminated because this information does not indicate a definitive answer to the question of whether Mr. Chaba had pulmonary tuberculosis or not.
Okay. So these tests are for TB meningitis. The tests for pulmonary tuberculosis would be different. We would look at the patient's symptom complex. We would start with a chest X-ray, and then we would send usually sputum samples for gene expert and culture. So these tests were aimed at trying to exclude meningitis in this patient, not pulmonary tuberculosis.
Yes, even if they were meant to exclude meningitis, at the end of the test, there was no definitive answer, scientific answer, conclusion to say he did not have.
As I said, we need to look at the entire clinical context and the other investigations. And the PCR gene expert was negative, which would be helpful, but not definitive. The culture result would have been very useful, but we only have 2 days. So yes, if we really wanted to, exclude tuberculosis or TB meningitis, then the treating physicians could have considered repeating the lumbar puncture.
So you
Yes.
agree?
Can we move on, Mr. Pichel?
Yes, thank you, Prof. Prof, I want us to look at the documents. You indicated earlier that you were not aware whether Mr. Chaba had seizures that morning. If you can turn to page 2860, there are nursing notes that were recorded on the 8th of August at 1640. Yes. You can just go through the entries. They are very short, so.
All right, the entry on looks like the 28th.
If you look properly, it's 08. Both the
Sorry.
one on top
Okay.
for 1640 and the other one for 1643. You can just read it on your own. There's no need for you to read it on record.
Okay, thank you, my lady. So it does indicate here that the nurse reported that the patient had seizures that morning, and they gave him the medications, correct?
Yes. So that basically affects your assessment because you worked on the basis that there was never a record of him having a seizure, correct?
And no, that's not correct. I just wasn't aware of exactly what time you were referring to, but it does indicate a seizure. But as far as I recall, Mr. Chaba was a known epileptic.
Yes.
Yes. And we also know that there is a link between pneumonia and having seizures and epilepsy and so on, correct?
Yes, epilepsy
In fact,
can...
people with epilepsy are more prone to pneumonia, correct?
Correct. Epilepsy can predispose to aspiration, which is a risk factor for pneumonia.
Come again, epilepsy can?
Epilepsy is a risk factor for aspiration.
Okay.
And aspiration is often an event that precedes the development of pneumonia.
So it's not so much that a person is starving, it's also a question of other factors that are involved.
Sorry, Advocate, could you please repeat the question?
Earlier you indicated, Prof, that in this instance, with reference to Mr. Chaba, you considered the malnutrition to be a factor that predisposed him to pneumonia. But now you have discovered another factor here, correct?
So, what I said earlier was that it's important to establish the underlying cause for the severe loss of weight. The pneumonia is often the final common pathway in many chronic debilitating conditions. And pneumonia, is, as you said, is correct, can have multiple predisposing factors. Severe malnutrition and wasting and an emaciated state is in itself a risk factor for pneumonia. Epilepsy and aspiration would also be a risk factor for pneumonia.
Yes. Now, let's get page 2861.
Just before you move, just give the professor the chance to answer your question. He has not yet answered your question. Now, his question, in fact, was basically that, right? Does that change your opinion? What does it say to your opinion?
So it is possible that he aspirated, but to have developed pneumonia so quickly after the aspiration, that would be unusual, especially as I recall the pneumonia that was described in the autopsy. So aspiration can result in various types of lung injury, but the pneumonia that was described in the autopsy, my impression was that had been present for some time and was not part of an aspiration pneumonitis that we may find, very soon after the event.
Yeah, but we know that he had epilepsy. Is it not possible that he could have had seizures before?
Yes, it is possible.
Yes, and this could have, in the process of having seizures, he could have aspirated something and developed pneumonia.
That is correct.
Yes, so nobody has put a proposition to you to say that he had a seizure on the 8th, and therefore the seizure that happened on the 8th was the cause of death, or it was the cause of the pneumonia. I mean, nobody has put that proposition to you, Prof.
So I was trying to establish the cause for the severe weight loss over the 2.5 month period, and the epilepsy alone would not account for that severe degree of weight loss.
Correct.
There would have to be another factor to account for that. Epilepsy can have numerous complications and side effects. The medication can cause side effects. And if the epilepsy is poorly controlled, that can lead to seizures. And severe malnutrition is a factor that it makes epilepsy control poor. So severe starvation or malnutrition could have led to an increase in seizures, which may also have played a role in this case. But the epilepsy alone does not explain the severe weight loss over the 2.5 months that the records that were available from the time Mr. Chaba left Life Esidimeni until the day of the autopsy, which was about 2 months later.
So by just a second, Mr. Pitler, what does it mean to your, after seeing this note, what does it mean to your previous opinion? Does it change it, or do you still maintain that you stand by it?
My lady, I stand by my opinion.
For the reasons that we've explained, that epilepsy alone can't lead to severe weight loss.
Correct, my lady.
Yes. In this instance, we now have information that Mr. Chaba had seizures. We also have information that he might have had meningitis TB, tuberculosis, because it was not completely excluded. We also know that he was epileptic. We also know that he had a spinal injury, which was not part of his proper makeup when he came to Life Esidimeni. Do you agree with me?
When you say that the TB was not absolutely excluded, that is correct at the time of the clinical evaluation at Pretoria West Hospital. But I think the autopsy would have found evidence of tuberculosis if that was the reason for the patient's severe loss of weight. But the autopsy did not find any evidence of pulmonary tuberculosis or tuberculous meningitis.
Prof, you'll agree with me that a post-mortem histopathological examination cannot distinguish whether a person has died as a result of TB disease or with TB infection.
I don't know what you mean. How do you differentiate those two? Just please repeat your question.
I'm putting a statement to you. It says that a post-mortem histopathological examination cannot distinguish whether a person has died as a result of TB disease or with TB infection. Latent tuberculosis, a person can remain asymptomatic and have no TB-related pathological abnormalities.
All right. Okay,
just a second. Ms. Asim?
I'm sorry, my lady, if Mr. Pitler could please just refer us to the page where he's reading that from.
Mr. Pitler?
My lady, I don't think it's necessary. I'm putting a statement here. If information is out there for everybody to gather, I mean, if the prof agrees with me, he agrees. If he doesn't agree, Luana, it's fine. I'll move on from it.
Is it somewhere contained in the record? Because you seem to be reading something.
I'm reading from my notes, my lady. I'm reading from my notes.
Ms. Asim?
Sorry, my lady, I was trying to establish whether it is in
the report or not.
whether it's in the record somewhere.
It doesn't look like it is in the
Yes,
record.
it's not on the record. So I'm not sure what it is that Mr. Piklela is reading. I don't know what authority it is that he's referring to.
Does it matter?
Yes, it does.
Yes, for us to understand, Mr. Piklela.
My lady, I'm putting a statement to a witness. Now, it could be my own assessment. It could be a scientific position. It could be anything.
Is it not important for us to know where it comes from?
If it is important for us to know where it comes from, then every question that
I'm
is
just
posed,
asking you. No, this one, you said you were reading something. Yes.
I'm reading my notes. I'm reading my
All right,
notes.
can we have let the witness answer and then we pass this? Otherwise, Mr. Piklela will be arguing the whole day.
As a court, please.
As court, please.
Yes. Can you read it properly to the witness for the witness to answer, whether the witness can answer or not, if he doesn't have any answer?
Doctor, are you familiar with latent tuberculosis?
Yes, in my opinion, latent tuberculosis implies that a person was exposed to TB and the immune system is able to contain the infection. The person does not develop clinical illness or significant clinical illness, and that latent TB can then become reactivated later in life if the person's immune system is impaired. And a person who dies from active tuberculosis would likely have clinical and pathological evidence of the disease. And it should be, a pathologist would be able to distinguish that from latent tuberculosis that has been contained in a small area, usually in the lungs.
Yes. Now, Prof, we were on page 2861. Part of the reason why Mr. Chaba was taken to or was rushed to the hospital was also because he had constipation, correct?
I cannot give the reason, why he was taken. I'm not sure if that was the motivation to take him to hospital.
No, I'm telling you, I'm putting it to you.
All right, I didn't read that in the notes, but I accept your statement.
Yes. Now, this were on page 2861. This is what I believe was observed at the time. Can you, because this handwriting is very bad, so can you assist us, or assist the court rather, to understand what is written there, what is recorded there?
All right, it is very difficult for me to read because the screen is quite small and condensed. So I really have difficulty reading this to you from this small print that I have to look at. There's a way to possibly enlarge.
Is there no way that can be enlarged?
May I perhaps assist to the extent that I can?
Okay. But let's see first if that cannot be enlarged. Yes, it's much better now. Doctor, can you look at it?
I will do my best to read it. 28 years old male patient. I think it says chronic patient from unknown hospital. Caregiver says she found the patient like this when starting to work on Tuesday. with a date looks like the 2nd of August. According to caregiver.
Yes, just read the year. It's also very important.
Okay, sorry. 2nd of August 2016.
Yes.
According to caregiver, he is a known epileptic, decreased GCS, complains of fits, post-ictal confusion. On examination, patient is chronically ill, Glasgow Coma Scale 9 out of 15, unkempt with dirty clothes. So if we could chest, BIL Krebs, which is short for bilateral crepitations in the lungs.
Bilateral?
Crackles or crepitations. This would be, could be one of the clinical signs of pneumonia in the chest. Then CVS, which would be cardiovascular system, S1, S2, which are the first and second heart sound. No murmurs were auscultated. Abdomen, tender, multiple masses on the abdomen. The rest is, I can't make out the rest of that, the last part of that sentence.
I think, okay.
Lethargic. I think it says lethargic or something.
Yeah.
Tender, lethargic.
There's something before it, my lady. I submit it is CNS, Central Nervous System. Lethargic.
C what? Is it not O? C?
CNS.
CR.
No, CNS, my lady, Central Nervous System.
Okay, C.
Lethargic.
Lethargic, but I don't know what that last word is.
Decreased GCS.
Just a second. Yes, lethargic, and then before GCS, what is it there?
Decreased. I think it's an arrow pointing downwards, my lady.
Okay, decrease. Yes, continue.
Then the assessments were, first of all, epileptic patient, then LRTI, which would stand for lower respiratory tract infection or pneumonia, query TB, and the second assessment is bowel obstruction. The plan was admit in Ward 7, tried to call surgeon with no success. And then a signature follows.
Just before you complete it, this scientific terms, just a second, I must go to Son of Man. Yes, just above bowel obstruction, epileptic patient, then slash
LRTI, correct, my lady.
What is that, lower?
Respiratory tract infection.
Okay.
Query TB.
My lady, the word after epileptic, is that not epileptic fit?
Yes, it looks like it's epileptic fit.
Yes, I agree.
Yes. And then the other one you said LRTI, then it looks like, I don't know what that is, and then TB.
A question mark, TB.
Okay. There you are, Mr. Pihlela.
Yes, so the bowel obstruction is in keeping with the autopsy report, where it noted that there were Malina stools, correct?
No, Melina stools is an indication of usually an upper gastrointestinal bleeding, which is different from the clinical picture of bowel obstruction.
So in a sense, he was constipated.
Mr. Pitlela, you are not going to be audible. Can you repeat that, please?
No, I want to understand this bowel obstruction.
Yes, but you must be audible on record, isn't it?
I apologize, my lady. Yes, Prof. I'm trying to understand this bowel obstruction and the finding of the autopsy.
All right, so bowel obstruction can have many different causes. So that would not, the notes here would not automatically imply that there was constipation or fecal impaction. We would usually perform a rectal examination, which would assist in the diagnosis of fecal impaction. But the bowel obstruction can have many different causes, and it's not clear here which of those causes the clinician was considering at this point.
So, would you regard the bowel obstruction as a normal process in a healthy human being?
No, I would not.
So it's one of those factors. It's one of those underlying factors that you are looking for. No? It's indicative of a problem. It is indicative that this person is going through an illness of some sort.
A bowel obstruction can occur very acutely, within hours or days. So that may not explain the longer underlying cause of weight loss, which I was trying to determine from the clinical notes and the autopsy findings.
Yeah, but a normal human being does not have, a healthy human being does not normally have bowel obstructions. Do you agree? It shows a problem with digestion, doesn't it?
A bowel obstruction is a serious disorder, correct?
Yes. Essentially, if I may posit a thesis on this, it shows that when a person eats or consumes food, they are not receiving all the proper nutrients from the food. So basically, the food is excreted from the body, not in a highly processed state.
You keep on breaking down. Continue. You might have to exit the meeting and rejoin, but let's try.
Yes, I'm saying, Prof, are you there?
I'm here.
Yes, I'm saying it could also be an indication that this person had a digestive problem. And now, in as much as they eat, the food is not properly digested in the body. It's not properly broken down. And therefore, it means that they are not receiving all the possible nutrients they can get from the food. Would you agree with me on that?
No, I do not agree with you on that. My understanding of a bowel obstruction is usually acute or subacute problem that there's no proper transit of food through the bowel, and this causes serious complications.
Prof, let's continue to page 2.
Before we go to another point, can I check as to for how long are we going to have the witness? I see it's 28 minutes past 11 now. Mr. Late? Are we having the witness for a full
My
day?
lady, I believe the doctor is available, or the professor is available for the day.
Okay.
Can
we then now take the tea adjournment and resume at 11:45?
Please call, please, madam.
The witness is sworn. Thank you.
Thank you, my lady.
May it please the court, my lady.
Thank you, Professor. You are reminded that you are still under oath. Mr. Pihlela?
Scott, please, my lady. Yes. Before the break, Prof, I had referred you to what is noted as a bowel obstruction, and the proposition that I was putting to you was that it is indicative of digestive problems. Now, do you agree with me on that fact?
A bowel obstruction can have many different causes. So it's the term digestive problems is very broad and doesn't really narrow it down to the pathology that could cause bowel obstruction. So it's usually an intra-abdominal problem that would lead to a bowel obstruction. That is correct.
Okay. Now, I'm going to put the proposition to you, Prof. Now, you'll agree with me that Mr. Chaba fell ill and was taken to Pretoria West Hospital on the 8th of August 2016.
Correct.
You'll also agree with me that he stayed at Pretoria West Hospital until his passing on the 15th of August 2016.
That is correct. He was admitted for about 7 days before he passed away.
Yes. Now, despite medical intervention, he was unable to be saved.
Correct.
Yes. Now, on page 2867, there is entries that are made. And I'm just trying to understand all these different entries because I'm not a medical person. So I think also it's to the benefit of the court that while you are here, you...
The date of the entry is the 11th, 08, 2016. A 27-year-old male admitted on the 8th of the 08, 2016 with a history of convulsions, not communicating, just staring, movement with wasting. So that part is not very clear. I can't, but just before the movement is very difficult to make out.
Yeah.
Looks like a number.
1107, I don't know, I'm not sure.
Yes.
But all we have on top is that not communicating, just staring, then movement, before movement we can't tell, then movement with wasting.
Maybe Advocate Van Margen can assist.
I'm going to do my best. Is that not an N-O-T?
Not movement.
That would be my best guess, my lady.
Because it looks like the previous one. Okay, continue.
Yes. And then below that is ENT, white plaque, CVS,
ENT.
Sorry, ENT, ear, nose and throat examination.
Okay.
White plaque.
Mm.
Then CVS or cardiovascular system, S1 plus S2. That would be the first and second heart sounds were normal. No murmurs were auscultated. Chest clear. Abdomen, sorry.
Yes, continue.
Abdomen, scaphoid. MS, which probably stands for musculoskeletal examination, wasted with fixed fusion.
If I may come in there, Prof, what does it mean when it says abdomen scaphoid or something?
I think it's part of the wasting condition that the abdomen assumes a scaphoid appearance. That would be my best assessment of that.
Yes, continue.
Then below musculoskeletal is neuro.
My lady, if I may just, with regard to the previous line, and my apologies to interject, I submit it's MSS, musculoskeletal system, wasted with fixed flexion.
Yes. Yes. Continue.
Okay. Neurological examination, non-communicating. And then assessment, constipation with CVA or cerebrovascular accident or stroke. And then pneumonia, right side. Then the plan would be a part of the assessment is the X-ray, which showed increased fecal loading. The plan is to continue management, administer a fleet enema, intravenous Ringer's lactate, which is an intravenous fluid, and then the entry is signed.
Yes. Then after the signature, LE, Apple or API, I don't know.
So I presume that's the name of the doctor who signed.
Oh, okay. All right.
Ready?
Do you want him to continue? Okay.
Yeah, we can just pause there because I only have one or two questions on this. So are you saying that according to this, does it mean where you're saying CUA or CUA that Mr. Chava suffered a stroke while at the hospital?
But this was the assessment, of the doctor at that time. And based on the findings above, where he said the patient was not communicating, I assume that part of his differential diagnosis may have been a stroke. But a patient may be poorly responsive as well after an epileptic seizure. So that would be another possibility. Because the neuro examination did not document any other clinical signs of a stroke. The only neurological assessment here is non-communicating. And a patient with a stroke would usually have additional neurological abnormalities that would be detectable on clinical examination.
And you can see here, it indicates that he was constipated, correct?
According to the notes, and that appears to be confirmed by the X-ray, which showed increased fecal loading, correct?
Yes. Now, when a person is constipated, do you continue to feed him?
Sorry, please repeat that.
Do you continue to feed a person when he's constipated?
Yes, so it depends on the person's appetite, and significant constipation could lead to nausea or vomiting or abdominal discomfort, but a person could still eat, yes.
Okay. Now, you will agree with me, doctor, that while at the hospital, the issue of pneumonia had already been identified, correct?
Well, there's some conflicting information, because the clinical examination that I read earlier for chest said clear. So at that point, it appears that the doctor did not hear clinical evidence of pneumonia, but the previous entry that had chest bilateral creps or crackles or crepitations, that entry, those clinical findings would be in keeping with pneumonia.
Yes. And I agree with you on that aspect, because on the one hand, it seems like the pneumonia was identified, but I unfortunately do not see how it was treated, unless you can come to the assistance of the court in that regard.
I presume that would have been treated with intravenous antibiotics, but we would have to look at the prescription, to confirm that.
And where would we find that information from? I think there's other information on the next page. Maybe it can assist us to see where, at what stage the pneumonia treatment began. Because if you look at the entry dated the 12th of August, there is an A and then there is pneumonia plus convulsions. Maybe if you can assist the court in that regard.
All right, so the previous page that was here, I saw Rossifin day 6. There it is, day 6 Rossifin. So looks like to me that if I read it correctly.
If you can spell that, where is that, doctor?
In the margin, my lady, just under the date. If we could just lift the page.
My lady, it's page 2868.
Okay, no, I'm on a different page. Page 2686. Page
2868.
2868. This will be an entry of the 14th.
That is correct.
Yes,
where the
so just below the date is day 6 Rossifin.
Oh yes, okay, yes, I can see that.
Yeah, it looks to me like ROCEPHIN.
What is this?
This is an antibiotic that would be used in the treatment of pneumonia. So this suggests that on the 14th, the patient had already received 5 or 6 days of intravenous antibiotics.
I'm sorry, I don't follow. Where do you get that indication, Prof, that on the 6 years already been receiving that treatment?
Because it says day 6 Rossifin. So we would normally write, when we start the antibiotics, day 1 or day 2, so that we can keep track of how many days this medication has been administered to the patient, because there's a limit. We usually limit the number of days that we would administer intravenous antibiotics.
Yes, but when I look at the sequence of pages, Okay, there is page 2866. Unfortunately, the information there is not visible. 2865, it appears as a blank page.
But do you understand, Mr. Pitlela, what the doctor is saying?
Yes, my lady. However, I'm struggling to see.
Yes, but remember, he's just interpreting what he sees here, how he understands it. On page 2868, under the heading, under the date, just under the time, 8:30, it says day 6, Rosephine. That's why he's saying that.
Yes, my lady. I see that, but the issue that I have is we have an indication, we have no indication of where day 5 is, day 4, day 3, day 2, and day 1.
I hear.
Or even an indication of when this treatment started, because for me the document starts on page 2861, unless I'm missing something. I see Advocate van Bergen's hand is up.
My lady, if I may assist my learned friend, if he looks at page 2861, that is the entry on the 8th, the date of admission. 2862
Yes.
is the entry on the 9th. So that's where the pages aren't in consecutive order. But if he were to look especially at 2862, that's on the 9th, and going through that page will indicate what treatment the patient received. I hope that assists him.
I'm indebted to the senior advocate on this aspect. I'm just trying to find that Rosepin thing, and unfortunately I can't make out the handwriting. Maybe the professor can assist. On page 2862, Prof, is there anywhere where it is recorded that he was placed on antibiotics on the entries that were made on that day?
I can't see very clearly, the entry that is on, looks like on the 10th. If you just above that, where it says plan, if you could just lower the document slightly, please. Sorry, the other direction, if you lift it slightly. The plan there just says continue treatment and to obtain collateral history. So that's all I can see there.
So you agree that it does not detail any antibiotics being administered to the patient in terms of what is written in this document?
The problem is we can't see the handwriting. Even when you go down, there are some clinical notes here I see there is a stamp of Dr. M.S. Pitswani. Just underneath where you have just read, Doctor, one cannot just make any sense of what is written here.
My lady, if I may assist, where the court indicates, it seems that there's Rosephine day 3.
Where is that?
Where the court indicated under the stamp of Dr. M.S. Pitswane, that's Rosephine day 3.
Oh, yes.
Yes, the problem is the stamp. It's on that, because I also doubted here. I thought this is something, but I can't see it properly because the stamp is on top of that. I just see day 3. I don't know what is written before it.
If I may assist further, if one looks at the bottom of the page,
yes,
the very last line, well, let's start at the 3rd. It says assessment, query, brain injury, query, it's a question mark, RVD, and then below that, LRTI, lower respiratory tract infection on day 3, and then ABX, which is an abbreviation for antibiotics. So that would confirm probably that the entry that my learned friend Ms. Marriott referred to It does look like Rossifin because it also says LRTI and then dash on, and it looks like Rossifin day 3.
I can't make anything of it. It's fine, but because as I'm saying, I see the stamp of the doctor is on top of that. Maybe it looks like it, but I'm not sure. All right.
Yes,
okay, but I think
if I may, if I may, my lady.
Who's that now, Mr. Late? Yes.
My lady, we've now spent a very long time on deciphering medical reports, and I cannot see where this is taking us at this stage. Really, what if Mr. Pishlela can just indicate to us where is he going with this? What's his argument going to be in the end? What is his client's version regarding this?
We don't even know what he's going. He has not yet put the version of the client, his clients, to the witness.
We're deciphering medical reports for more than 2 hours now, and there's been no proper statement as to where we are going with this.
Can the doctor just step aside, please?
Will do.
Mr. Pishlela? And he has not touched on the other, his other client. No, not necessarily the other patient. We are still on Terence Chava, Mr. Pishlela.
My lady, I think I assumed that the purpose of this inquest is to find out why Mr. Chava, among others, has died. And in so doing, we need to look at the medical records and everything that is on record, because therein there might be an indication of a cause of his death. And I think that is relevant. It doesn't help us to just brush over issues and then move on to the next one as if we are on an assembly line. I'm looking at the medical information that is available to me, because I also cannot understand why Mr. Chaba was in hospital on the 8th, was receiving treatment, but eventually succumbed. There is no indication of why he succumbed, except to say pneumonia, which was being treated. So if medical intervention could not have helped him, then that should be a conclusion that one should be able to reach and that the court should be able to reach.
Mr. Leet?
My lady, medical intervention is not and never was a novus actus interveniens, where an act caused the death of a person. The lack of medical intervention never can act as a novus actus interveniens, where there is a primary act that caused the death of a deceased. If Mr. Pishlela wants to show that there was medical negligence, then tell us this and show us where he wants to go with it. But to sit here for 20 minutes and decipher the name of an antibiotic is not going to take us anywhere. It's senseless to do that. If he can show a medical condition according to him that might have caused the death, do so and ask the professor straightforward about that. But to sit and rake through every little word and dot in the medical files will not take us anywhere.
Mr. Pichel?
My lady, with respect to Mr. Late, some of these documents are not visible, even to somebody from the medical profession, and that is an issue. And that in itself is an aspect that can be presented in argument. I cannot present that aspect to this this professor, because the fact itself speaks to itself. If I cannot see the document and a person from a medical profession cannot see the document, we all know the prejudice that occurs from records that are incomplete or that are where records are lost and so on. But I'm not arguing that fact. All I wanted to establish was to be sure that indeed Mr. Chaba had received medical treatment and the type of medical treatment that he received.
You have
Now,
got the
I've been
information.
able to, yes, my lady,
The
I've been
doctors
able to
assisted.
establish that, and I was ready to move on from that issue.
The doctors
And in
assisted.
addition to the, yes,
The
my lady.
doctors
So,
assisted Mr. Pikela. Please come clear.
Yes.
We should know where you are getting. You have spent so much time on this aspect. It is true.
yes,
Please move
my
on.
lady, unless the issue is that the medical records are irrelevant, then I should be allowed to ask about
No
the
one
medical
is
records.
saying they are irrelevant. You have made your point. Can you please move on and let us know where you are getting? Because up to now, you have been on this medical records and we don't know where you're going. Let it be clear to the professor so that we can move on, please. Continue.
lady,
Can the doctor be called?
Yes, court, please, my lady.
Thank you, doctor. Continue, professor. We don't even know whether it's doctor or professor. We'll call it.
Fine, my lady.
Yes.
Prof,
Mr. Pichela, you may continue.
Prof, the version of my client is that on the 23rd of June, 2016, she collected mental health care users, among whom was Mr. Terence Chava. And this proposition is on page 2799. It's a statement that was made with specific reference to the case of Mr. Chava. It's on page 2799. And that is on paragraph 3.
Page?
2799, my lady, paragraph 3.
Yes, continue.
Yes. And that this patient, when she was presented, did not have any clothes, did not have clothes with him, had only a toothbrush and a washing cloth. That is what, do you have any comment on that? Prof, did you hear me or should I pass?
Advocate, I can see what's written here, but
Yes.
I can't give any further comments on that.
Yes. And you'll note that the 23rd of June was in winter, correct?
Correct.
We need to hear your comments. If you can't, you tell us, doctor.
And
That
if you are transporting, pardon?
I say I confirm that June the 20th would be in the winter months.
Yes.
Yes, and this person was being transported without clothes, correct?
I can just see what's written here, but that's all I can comment on, Advocate.
Yes. Now, we also know that he subsequently contracted pneumonia, correct?
At the time of his admission to Pretoria West Hospital, there was clinical evidence of pneumonia, and the autopsy findings did confirm the presence of pneumonia, yes.
Yes, and it is, you cannot really say when that pneumonia was contracted, correct?
Correct.
Thank you, Prof. Lastly, Prof, on the issue of food, My client's version is that she was given patients by the Gauteng Department of Health to look after. She had experienced shortages of food. She was not being offered financial support. She had complained to the relevant people, amongst whom were Ms. Hannah Jacobs, for intervention in this regard, and that was not done.
Do you want to comment, Professor?
I'm not aware of that. My task was to try and evaluate what the underlying cause of death was for Mr. Chaba. At the time of his autopsy, he was in a severely emaciated state with a weight of about 40 kilograms. So he had lost a very significant amount of weight. And my task was to try and establish if there was a cause, if a cause was, present for his severe loss of weight. But I cannot, comment on anything else.
Yes, and you will agree with me, Prof, that not having food and being denied food are two different things.
Yes, a person could be in a state where they cannot ask for food, or they may not be able to chew and swallow their food. So there are different scenarios that could lead to a state of semi-starvation or starvation. That is correct.
Yes, and also within the context of the NGOs, NGOs being given patients with no support, with no financial support to buy food, to buy clothes, to buy bedding. I don't know if Mr. Late wants to say something.
My lady, yes, this is a clinician. The witness is a clinician who gave his clinical evaluation of the deceased. The circumstances at the NGOs and the people who are responsible for that, this witness cannot answer about that. Mr. Pacella, with all due respect, can keep that for his argument at the end of the case, of the inquest.
My lady, I agree, however, with one provision. The thing is, I have to put this version to this witness, not so that he can, because he's going to give us insight into that or not. But at the end of the day, I don't want to be accused of not having put that to the witness to respond and so on. I was finished with this witness on this aspect when Mr. Late interjected, but I do understand where he's coming from. But
yes,
that is the vision that I'm putting to the witness.
Mr. Late, do you want to say something? I see that.
Yes, my lady, your obligation to put your version to a witness doesn't go to any witness. The obligation to put your version to a witness is to put the version to a witness where such a witness can be of assistance to the court. Yes. It's not a umbrella obligation to a legal representative.
Thank you, Mr. Piclela. Please refrain from doing that.
My lady, we are past that point. It wasn't really necessary because I'm done with the questioning on Mr. Chaba. It wasn't even necessary.
Before you may proceed, Mr.
Object because we wasted a lot of time when that question could have easily been.
Mr. Piclela?
Thank you, Prof. We are done with Mr. Terence Chaba.
If you can just lower your hand, Mr. Late. Continue, Mr. Piclela.
And just to clarify you, the reason I put those circumstances to you was so that you also know that there were other factors which I believe when you were compiling your opinion, you were also concerned about why the weight of Mr. Chaba was that way and this and that. That's what I understood you to mean, and I was just giving you closure in that regard.
Are we still on Mr. Piclela and Mr. Chaba? I thought we have moved on.
Exhibit S2 on page 3274. If you look at paragraph 4 on page 3275.
Paragraph
4.
Yes.
You agree with me that what is stated in there where you're saying condition satisfactory, well nourished, and
No,
this with
Mr.
reference
Michel,
to the progress notes?
just stop there. You broke a lot. Please repeat.
Prof, earlier when I was dealing with your opinion with regard to Mr. Chava, we dealt with the issue of the progress notes and what they recorded. Do you still recall?
Correct.
Now, if you look at paragraph 4, it again makes reference to a different patient under different circumstances, but the condition is recorded almost similarly, almost the same. Condition satisfactory, well nourished. Do you see that, Prof?
Yes, I do.
Now, would you don't you think it is somewhat strange to just be writing or making this type of comments on two different people?
Not necessarily, because I think it is important information to document the patient's condition at the time of leaving one institution and being transferred to another. So I think it is important information that was documented.
Yes, but we also know that for a transfer to have been undertaken properly, there must be two teams who are assessing. The receiving and the transferring teams, both of them must assess, they must agree on the findings, on the physical appearance, on the psychological aspects. There must be a professional nurse, there must be a doctor, there must also be a psychologist.
Yes, I agree with you, but unfortunately, the only notes that I could find in the records that were given to me were these notes from Life Esidimeni. I looked for notes on the receiving side, but I did not find those in the records.
Yeah, because what Ms. Move will come and testify to is to the fact that that assessment was not done at the time of handover. It was not done. And that the department, the Gauteng Department of Health had promised to send people to come and conduct this assessment, but that was never done. And that is the reason why you do not have those notes and they are not there.
Right. I mean, I cannot comment on that, but I was just again trying to establish a baseline for Mr. Maseku's condition when he left Life Esidimeni in order to compare that with the findings at the autopsy a few months later. And this was part of my attempt to use the subjective and objective information that was recorded by Life Esidimeni to assist me in establishing this baseline.
Yes. Now, let's look at Mr. Maseko's treatment history. There is a document on page 3156.
Page
3156.
Yes, I see it.
Now, were you also concerned with Mr. Maseko's weight loss?
Sorry, could you just repeat that?
I'm saying, were you also concerned with Mr. Maseko's weight loss?
Yes, he lost about 43% of his weight from the time that he left Life Esidimeni until the day of the autopsy, when his weight was again recorded by the forensic pathologist. So he had lost a very significant amount of weight, correct?
Yes, and we know that Mr. Maseko is also another one of those who died at Pretoria West Hospital.
That is correct. He was recorded as dead on arrival at Pretoria West Hospital.
Yes.
So he was not even admitted.
No, my lady, it's my understanding he was dead on arrival.
I'll clarify that aspect during my cross-examination, my lady. It's called places. So, with reference to Mr. Maseko, you would expect that your concerns, similarly to Mr. Chaba, is that he must have suffered drastic weight loss while at the NGO, correct?
Or I have his weight recorded at the time that he left Life Esidimeni, and then his subsequent weight on the day of the autopsy. And so I was trying to establish what the underlying cause was for this very severe weight loss and the emaciated state that he was in at the time of the autopsy.
Yes. Now, Mr. Maseko was admitted to hospital. Before I deal with that aspect.
I'm going to request you to repeat. You seem not to be that audible.
Apologies, my lady. Mr. Maseko,
Just
obviously,
for me, I just want to close the window. Yes, continue. Thank you.
yes. Now, obviously, the drastic weight loss that you described would have been a concern to any medical officer, correct?
Correct.
And it would have been apparent to anyone that this person has lost a lot of weight.
Yes. If I recall, his weight was about 35 kilograms on the day of the autopsy, which was, and also when he was admitted to, or when he arrived at the hospital, he was in an emaciated state, and that would have been obvious to the clinicians, yes.
Yeah, and it would have triggered an emergency response, ordinarily.
Well, I mean, we first deal with the reason for the patient's admission to hospital, and then we would start a clinical, perhaps radiological assessment to try and determine the cause for this emaciated state, yes.
Yes. Now, were you aware that Mr. Maseko has previously been admitted to Pretoria West Hospital on the 26th of August?
Yes, I recall that.
Yes. Now, obviously, the 26th August, and he was subsequently discharged on the 30th of August.
Correct.
Were you aware?
Sorry, I cannot hear you.
I'm saying he was admitted on the 26th and discharged on the 30th of August.
Yes,
Yes,
Are
he
you
says
aware
he-
of that?
Yes, he says he was away. We can move on.
Three days later, on the 3rd of September, he aspirated on food and then he died.
correct.
Yes. Now, you've also indicated that obviously he could not have lost all that weight in the 3 days prior to his death, correct?
Correct.
Yes. So it must have been apparent when he was admitted on the 26th of August at Pretoria West Hospital that this man has lost a lot of weight, correct?
Yes, I agree with you.
Because he was in hospital for treatment of cellulitis. Were you
Yes,
aware of
I
that?
can't hear you, Mr. Pichel.
I'm saying, my lady, that he was in hospital for treatment of cellulitis.
Yes.
That is what the notes indicate, yes.
Yes. Now, when you, as a medical professional, when you receive a person who looks to be in an emaciated state, you're receiving that person in your hospital in an emaciated state, would you discharge him back to the same place where he came from if you had real concerns about him and about his weight and about his condition and about how he presented at the hospital and so on?
So I would have treated the acute problem, which could have been life-threatening. So that would have been my first priority. My second priority would have certainly have been to try and establish why the patient was in this emaciated state, because severe malnutrition and weight loss has numerous complications that in themselves are life-threatening. So I would really have wanted to try and establish what the cause was for the severe emaciated state. Because once a person has lost about 40 to 50% of their body weight, then death is almost inevitable. So we would really want to try and intervene as early as possible to prevent the severe organ dysfunction and organ failure that occurs during the latter stages of severe malnutrition and weight loss.
Yes, you wouldn't have released him back before you made sure that this man is well and he's in a good stable condition, correct?
Yes, I would have wanted to establish why he was in emaciated state, because that could have been potentially treatable or reversible, and time would have been an important factor then, because as the wasting progresses, the chances that we would be able to reverse it or treat it becomes less and less. So yes, it would be important to try and document the cause and treat it if possible.
Yes. Now, on the 3rd of September, it is said Mr. Maseko choked on his food.
Come again?
He choked on his food. He choked while eating.
Correct.
Yes. Now, the version that my client will present is that Mr. Maseko was eating, he choked, an ambulance was called, the ambulance never arrived. She had to take her own private vehicle to try and transport Mr. Maseko to Pretoria West Hospital. And that on arrival, she indicated to the nurse that Mr. Maseko still had a pulse, but unfortunately, he passed on soon thereafter. That is what my client will come and say.
All right, I cannot comment on that.
Yes. Now, bearing this in mind, that an ambulance was called on that day and that none arrived, do you not think, in your opinion, as a person who has been trained in the medical field, that when a person is choking, the earliest intervention could have assisted?
I agree with you. So there are interventions that could have been performed at the bedside, or where the patient was when he was choking, such as the Heimlich maneuver to try and get the obstruction out of his airway. But absolutely, the sooner a person like that can receive medical attention, the better.
And obviously, if the ambulance had arrived, they would have been better equipped to perform those Heimlich maneuvers or to even put him on oxygen, correct?
I don't think you are audible, Mr. Pichela.
Prof, did you catch the question?
Yes, and I agree with you. If the ambulance personnel would have probably had the equipment to assist the patient under those circumstances. I agree.
Thank you, Prof. Would you say that I think I'm going to leave it there with reference to Mr. Maseko. I just have one more question for you, Prof, with reference to Mr. Mvulani. And the question I have for you is, I know that...
Before you go to Mr. Mbulani, isn't it you said your questions were limited to the two? Was Mbulani at one of your... Oh, the two were at Precious Angels, and then Mbulani?
Mbulani is, I think it's... Where is this place? I think Mbulani is for Mr. Profi. I'm going to go Mr. Profi.
Yes, what is the reason for that? Before you have to explain yourself before that question we allow it.
My lady, the case of Mr. Mvulani is similar to the case of Ms. Virginia Macapella.
Okay.
In terms of the findings, the pathological findings, and also the physical observations that were made on the corpse. There are certain similarities which perhaps the learned professor can be able to assist.
Let's hear, and if...
Now, I only want to understand one thing, Prof, with reference to Mr. Mvulani, and that is, according to the post-mortem report, he was observed as having sunken eyes.
You are moving. Please don't talk when you move because you are not going to.
My lady, I was just fetching the document.
You can just fetch the documents and come back, please.
As court pleases. Did the professor catch? Okay, Prof. Let's go to page 4503.
Remember that he didn't give his opinion on this one.
My lady, he gave his opinion on Mr. Mbulani.
Oh, okay. This is Mr. Mbulani.
Correct.
Yes.
Page 4503, paragraph 4.3, there are findings that are recorded there.
Can you first see the first page? 4502. Oh, this refers to an unknown person.
Yes.
An unknown adult male.
Yes.
All right.
Now, on page 4, on paragraph 4.3,
Yes,
what
I
about
see it.
it?
yes. I see that term again that you refer to with reference to Mr. Chaba. There is a scapuloid-shaped abdomen. Do you recall?
Yes, I recall.
Yes. Now, there is also an indication that this person had, the eyes are sunken.
Yes, I see that.
What does that tell you? What is the cause of this sunken eyes?
So usually, clinically, the concept or the term sunken eyes is used in children and babies to indicate it's a clinical sign of dehydration in children. In adults, we do not use it that commonly because there are other clinical signs of dehydration. But the impression, which is obviously a subjective impression of sunken eyes, can occur with severe wasting in association with dehydration in an adult.
So you're saying it is attributable to dehydration
and severe loss of weight and severe loss of fat tissue.
Now, is there, in your experience, is there a specific test that you would use to conclusively eliminate all those other factors that might
You're going
manifest
to
themselves?
Mr. Pichela? Please.
My lady?
Yes. If I stop you, you must know that I'm worried about the record.
Apologies, my lady. Doctor, in your expert opinion and experience, is there a specific test that will conclusively indicate to us why a person has sunken eyes?
I think you would look at it in the clinical context. So in a patient who is severely wasted and emaciated, then the most likely cause would be loss of tissue due to the severe emaciated state.
Now, would the refrigeration for extended periods be a factor in that regard?
I wouldn't like to, comment on the forensic pathologist's expertise, so I cannot give you an answer on that.
No, I'm saying refrigeration. If a person is kept refrigerated for extended periods of time, will that be effective?
Not as far as I know.
The doctor has heard and he has answered, isn't it? You are repeating the question. The doctor has answered.
Okay, just last thing. Despite these findings of sunken eyes being or cachexia,
You are going to repeat.
poor nutrition. Doctor or Prof, despite these findings of cachexia, poor nutrition, sunken eyes, I see that in terms of your opinion and the post-mortem examination and also the findings of bed sore, you still maintain that death was due to natural causes, correct?
I don't think I used the term natural causes per se, but in my opinion, this patient had multiple comorbid associated conditions that could have resulted in significant loss of weight. So the potential underlying cause for this patient's significant loss of weight were these multiple comorbid conditions. That was my opinion.
And what are those?
Just before you answer, the question is not going to be captured on record. Mr. Pihlela, I'm going to ask you once more. Please exit the meeting and rejoin.
My lady, I think it's resolved. And that is my last question.
Because this is now persistent. I don't want to keep on. Continue. It appears now it's even worse. You are muted, Mr. Pihlela.
Doctor, Prof?
Yes, I hear you.
Yes, I'm saying with a reference, you indicated that there are comorbidities, which you found that were, I'm sorry, my lady, am I audible now?
No, you are not. Try again.
Doctor, this is my last question to you, Prof. Now, you indicated that there were comorbidities, correct?
Correct.
Yes. Now, I want to know those comorbidities that you found were more of an important consideration than what was recorded in the post-mortem results.
No, that is not correct. I was trying to ascertain whether the autopsy had been able to identify the underlying cause of death, and the patient's clinical condition when he was admitted to Kalafong Hospital, the comorbid conditions described by the physicians who admitted him at that time, these conditions could have accounted for the significant loss of weight that the patient experienced. So that was my feeling, that it would be very difficult to ignore those comorbid conditions as potential causes for his significant weight loss and later his passing away.
Yes, and what I'm asking you and what I'm trying to establish is, what are those comorbid conditions that you are referring to, Prof?
Okay, I think I did mention them in the report, but I think he was documented as having a background history of hypertension, which resulted in cardiac dysfunction and heart failure. He was also an epileptic. He had a previous stroke, and there was clinical evidence of a stroke.
Just go slow, doctor. One, he had a background history of hypertension, which resulted in
cardiac dysfunction and heart failure.
Yes.
And if I recall correctly, he was also a diabetic patient. And these would be significant risk factors for cardiovascular disease and atherosclerosis. And the atherosclerosis could have predisposed this patient to the stroke that was documented in the clinical notes by the admitting doctors at Kalafong Hospital.
Yes.
It was also noted that the patient had a multi-infarct dementia, which would be a complication of multiple strokes. I think he was also an epileptic. I'll just have to confirm that in my notes.
Yes.
And it was my opinion that the previous strokes and the cardiac failure and the diabetes, all of these could have resulted in cognitive decline. And these could also have made it difficult for the patient to swallow. And if he's not able to swallow properly, he would be predisposed to aspiration. His cough reflex may also have been impaired as a result of the strokes. And the combination of difficult swallowing and impaired cough reflex would have predisposed to pneumonia. And if he did have difficulty swallowing or chewing, that could have resulted in loss of weight. And there were other issues that could have accounted for the loss of weight.
So it wasn't just a simple case of nutrition. There were other factors that could have accounted for it, no?
Correct.
Thank you, Prof. My lady, that concludes my questioning.
Thank you. Is that all? Can I check if were there other people who would have liked to cross-examine the doctor and have reserved? Mr. van Bergen, I see it's 1 minute before 1 o'clock. Mr. van Bergen?
Yes, my lady, I won't be long with the doctor, with the professor. My apologies.
Just before you proceed, there is also, Mr. Huedes? Mr. Huedes? You are muted. Something could be wrong. Miss Govender, can you alert Mr. Huedes that we can't hear him? Anybody else? Those who said they were reserving their cross-examination until Mr. Pitlela cross-examines?
My lady, I can't remember that anybody reserved the cross-examination.
Yes, I'm just checking, but there were those.
Mr. It wasn't with reference to this witness.
I can't hear you.
My lady, it wasn't. Apologies. It wasn't with reference to this witness, my lady. It was with reference to Dr. Talatala.
Talatala.
Yes.
Mr. Huedes, can we hear you?
Yes, we have no questions for this witness. Thank you, my lady.
Okay, thank you. Mr. van Bergen, you may continue.
Thank you, my lady. I see somebody's hand is...
No, let me just quickly check here.
It's yours, Mr. van Bergen.
My apologies. Thank you.
Just give me a minute. I think, Mr. Pitlela, it's correct to say it was not in respect of this witness. You may proceed.
Thank you, my lady. Professor Tintinger, just by way of background, my name is Harry van Bergen. I represent Life Esidimeni in these proceedings. I just have a number of clarification questions that I wish to put to you. If I understood your evidence correctly relating to specifically the deceased Mr. Terence Chaba, your concern was to find a cause for Mr. Chaba's severe weight loss, which you said was in the order of 27% over approximately 2.5 months. Is that correct?
That's correct.
And if I understood your evidence today correctly, the medical conditions that my learned friend Mr. Pitlela referred you to were of a nature that, in your opinion, could not explain that drastic and rather swift weight loss.
That is correct. The immediate cause of death should be differentiated and distinguished from the underlying cause of death. And the underlying cause of death was not established at the autopsy, in my opinion.
Yes. Professor, in order to maintain health and maintain body weight, one needs a minimum intake of calories per day. Is that correct?
That's correct.
Would you happen to know the number of calories that's required per day?
So it would differ according to the level of activity, but it's approximately 2,000 kilocalories per day.
Right. And if there is an insufficient intake of calories over an extended period of time, would that automatically and without any doubt result in weight loss?
So it's important to consider the level of energy expenditure in relation to the energy that's being given to a person each day. So a person who is on a hunger strike and only takes water would lose about 2 to 3 kilograms per day. But that would be without any additional calories or energy, and presumably someone who's not very active. But the relation between energy expenditure and energy intake would determine the rate of weight loss.
So if I understand you correctly, if you take in only water and you are relatively inactive, you could lose up to 2 to 3 kilograms per day.
Per week.
Per week.
Per week, yes.
Thank you.
Per week. That is correct. So the person would lose about 0.7 to 1% of their body weight per day, or about 2 to 3 kilograms per week if they were taking just water.
Right. Professor, and if a person who is relatively inactive, almost to the point of being almost completely inactive, were to receive only one meal consisting of vegetables and rice per day, can you give some indication of the nature of weight loss one can expect?
So there would probably be
Professor?
Just a second, there is an objection here.
My lady, we are now venturing into the realm of speculation. The doctor is not a dietitian, and the question is too broad. I think the Learned Council should be more specific in terms of put facts which are known or which are accepted with reference to Mr. Chaba, if we are still talking about Mr. Chaba. I haven't heard anywhere where it was said that Mr. Chaba was only being fed vegetables and whatever. So if that's what the Land Council wants to propose, then he should be clear about it.
Mr. Late?
My lady, I have to agree with Mr. Pishlela. This questioning is bordering on fishing expedition. We don't know what the people were fed each day and how much they were fed each day. This is just speculation. It's not going to take the court anymore. It's in the same realm as the broad questions that were asked to witnesses in the beginning of this inquest, as the court is, my lady.
Mr. van Bergen?
Thank you, my lady. My lady.
Can I excuse the witness for a while?
As your ladyship pleases.
Yes.
Cool.
Thank you, my lady. In the docket of Mr. Chaba, there are two affidavits. The first by a witness, Tefo, T-E-F-O, on page 2874, and also the evidence of Mr. Nofile, N-O-F-I-L-E, who testified in these proceedings. His affidavit appears on page 2876. In Mr. Tefo's affidavit on page 2875, paragraph 5, he refers to the users at Precious Angels having received, instead of 3 meals per day, more often than not, only 1 meal per day consisting of vegetables and rice. And the same is said by Mr. Nofile on page 2877, paragraph 5. So I'm not speculating, I'm not grabbing evidence out of thin air. This was said by these two witnesses in respect of an institution where Mr. Chaba had been. I submit it is relevant and should be allowed.
Can I hear Mr. Mr. Late from them, Mr. Pichela?
But that's exactly what I said to the court. I said we don't know how much of the specific food sorts were fed to these people. Once a day, it could have been a bowl of rice and a bowl of vegetables. We don't know how much they were fed. And without knowing what kind of vegetables, because vegetables are different kinds.
In the statements, Mr. Late, in the statements, Mr. Nofile, as far as I can remember, he talks about cabbage and carrot. That's all what we had. Well, we don't know the quantity, you are correct. But
we don't know what the quantity is. We don't know how much.
But the evidence was that they were fed only once a day.
Yes, I know, but still, Mr. Van Bergen is asking this witness to speculate because we don't know how much they were fed and how much Mr. Chaba especially was fed, and whether at all he refused to eat or whether when he was fed, how many days he was fed. It's a very broad statement by those witnesses. And to ask this witness to speculate on the amount of weight loss on that little information that we gather from those two statements is asking him to speculate. It's not asking him to give an expert opinion, really.
Mr. Pichel?
My lady, I think Advocate Late has captured it correctly and sufficiently, because to me it's too broad. I mean, that statement that people were fed, we don't know which date, we don't know whether it was for the duration of or when that the food shortage occurred, whether the food shortage occurred at the beginning, in the middle, at the end, on what days, on which month, whether it's relevant to even Mr. Chaba. We don't have that information. I think if the learned counsel had established that with Mr. Nofile when he testified, then I would not have an issue with it. But Mr. Nofile was not limited to specifics. So we can't ask this witness to now speculate on Mr. Chaba.
Mr. Van Bergen?
Thank you, my lady. My lady, it is not speculation, or it will not be speculation on the part of Professor Tintinger. He is a specialist physician. He has knowledge of the caloric intake requirements to maintain health, as he has already testified and which was not objected to. The question as to how often they were fed and how big the meals were and so forth, there are additional witnesses that are still going to come, my lady, and that can be determined. We only have Professor Tintinger at this stage, who can give an indication of what can be expected in the event of a patient, as I described, having received only one meal consisting of vegetables and rice per day. And if he says he can't say, if it's too broad, then that must be his answer, and I will live with it. But I submit it is relevant.
Mr. Pichela? Do you still want to say
yes,
something?
my lady, but for how long? Do we know for how long they received that kind of meal?
You have made that point.
Yes, that's my worry, because we don't know the duration. If the question is being put in a scientific manner, we're saying you're receiving one bowl of rice with cabbage and carrots for a period of five days. How much calories would there be, and how much deficiency would that have created?
Fine. It's fine. I'm going to allow the question. The doctor will explain. Thank you. Can we call the doctor back? Yes, if you can rephrase the question.
Thank you, my lady. Professor, the question that I put to you is, maybe I should just repeat the question. Can you give an indication of the amount of weight loss you would expect in a relatively immobile, inactive person who is fed one meal per day, and assume it is a generous helping of vegetables and rice?
It would be difficult to quantify that because the important issue is the balance between energy in and energy being used. So, yeah, all I could say is over a 2 to 3 month period, we would have expected weight loss of less than 5%, which would be about 3 kilograms for Mr. Chaba. And if he was not taking in any calories, he could have lost up to 2 to 3 kilograms per week. But it's really difficult to give you a definitive answer there on that.
Thank you, Professor. Professor, if you...
Mr. Pitlela, if you just put your hand down, unless you want to say something. Thank you.
Apologies, my lady.
Continue.
Thank you, my lady. Professor, I just want to make sure I have the right page number. If your ladyship will just bear with me. Professor, if you could, or if my lady, if Ms. Stevenson or Ms. Marriott could perhaps assist in putting up page 2861.
Can you assist Ms. Stevenson? Okay, proceed, Mr. Van Bergen.
Thank you, my lady. Professor, you will see that this is the entry at the Pretoria West Hospital that my learned friend, Mr. Pitlela, had previously referred you to. It is the doctor's admission note on 8 August 2016, which reads, 28-year-old male patient, chronic patient from unknown hospital. Caregiver says she found the patient like this when starting to work Tuesday, 2 August 2016. According to caregiver, he is a known epileptic with decreased GCS. And I think complaining of fits, post-ictal confusion. And then the description, patient is chronically ill, GCS 9 out of 15, unkempt with dirty clothes, chest bilateral crepitations, and so forth. My question to you, Professor, is can you comment on the appropriateness of finding a patient in this condition as described by the caregiver on 2 August 2016, but the patient only being taken to hospital on the 8th of August?
Come again?
But the patient only having been taken to hospital on the 8th of August 2016. Professor, sorry, did you get the question?
Yes, sir. I just see there's a hand.
Okay, that's fine. I'll attend to that. Mr. Pitlela?
My lady, I think the issue of the date is a mistake. It's being recorded as a mistake. I mean, I haven't seen, unless we can refer to the statement of that person in particular where that date is repeated, who was reporting. But from the statement that I've seen, I haven't seen an incident that occurred on the 2nd. Because if Mr. Chaba was taken to hospital,
yes, the understanding was... Excuse the witness again. You'll bear with us, Professor? Yes.
I will do, my lady.
He was attacked on the 8th, and that was the same day that he was taken to hospital. So unless we can see where the date again is repeated of the 2nd, because I assumed it was merely a mistake, my lady.
Mr. Van Bergen?
Thank you, my lady. My lady, with respect to Mr. Pishlela, I don't think he is in a position to say whether this is a mistake or not. The person who wrote this entry specifically says the caregiver...
This is on which, on
2861, my lady.
Yes.
The person specifically says, and I'm referring to the 3rd line of the entry, caregiver says she found the patient like this when starting to work Tuesday, 2 August 2016. I've looked at my calendar, and the 2nd of August 2016 was indeed a Tuesday. So it doesn't seem like a mistake, my lady, not having the day of the week and the date corresponding with each other.
Yes, Mr. Pitlela, do you want to say something before I rule on the matter?
Yes, my lady, the issue is now we don't know who that caregiver is. And that is a problem, because now if we don't know who the caregiver is, then we cannot challenge that evidence.
But it is there. In any event, it is written here.
It is prejudicial. Yes. It is prejudicial to my clients, because now they cannot gainsay what this person has been saying.
But we cannot be selecting. This is something that has been written here. Mr. Pitlela, I'm going to allow this question, and then for the doctor to comment. We've got the record. If there is something that shows that indeed there was this, obviously it comes from somewhere.
As your ladyship pleases.
Thank you.
Yes.
Where is the witness? Yes, I don't know whether if you can just remind him of the question or...
Thank you, Madam. I shall do. Professor, the question that I put to you with regard to the entry on page 2861, which indicates that the patient had been found like this on the 2nd of August, Tuesday, 2 August 2016, but was only taken to the hospital on the 8th of August 2016. Can you comment on the appropriateness or not of that delay between 2 and 8 August 2016?
I think the findings that were recorded there on the 2nd of August would be of concern to me, definitely. There were two things that I would worry about. First,
just hold it there, Mr. Pitlela. Is that something else, or is your hand down? I see your hand is still up.
My lady, I don't see anywhere on the statement where it says he was only taken to hospital on the 8th. That is an assumption that is being made.
Because now you keep on...
The only thing that is there... The only thing, my lady, that is there is a recording that was found on that day. I don't see anywhere where it says he was only taken to hospital on the 8th. The entry on that document is made on the 8th, but that does not in itself presuppose that he was only taken to hospital on the 8th.
My lady, if I may respond.
That is the issue.
Just a second, Mr. Pitlela. You must make your point and we move on, right? You have made your point and the court has ruled. Can I hear you, Mr. Van Bergen?
Thank you, my lady. If I may refer your ladyship to page 2860.
Yes.
That is the admission entry in the casualty department on the 8th of August 2016 at 1640. Which reads, a 28-year-old male patient brought in casualty on a wheelchair accompanied by a nurse. Patient is awake, not responding, breathing well on room air, nurse verbalized that patient had seizures this morning and they gave him medication and he started again this afternoon. Vital data taken and recorded. So that confirms that this was the admission entry in the casualty department on the 8th.
Mr. Pichela, before the witness responds, do you want to say something?
Lady, the point that I'm making is this. It does not say that he was only taken on the 8th. That is not specifically mentioned. It's a deduction that one will have to make based on whatever reasoning or whatever side of the coin that they are looking at this thing from. If it was as simple as that, then it would appear on there that the patient is only being taken on the 8th. So that is something that the learned counsel can argue. But it's not something that can be put to the witness as a fact, because it's not.
Thank you, Mr. Pichela. Ms. Marriott.
Thank you, my lady. If we go to page 2768, that's the statement of Efongube, paragraph 3.
Page
768.
2768. 68. What does
paragraph
it say?
3.
Paragraph
3. Efongube states, on 8 August 2016, the patient was not well, whereby I transported the patient to Pretoria West Hospital. So I don't know why Advocate clearly says that this is not a fact. His own client states.
So you agree with Mr. Van Bergen?
Yes, my lady.
Okay, thank you. Mr. Van Bergen, do you want to say something?
My lady, I submit that both the hospital record, and one can also look at page 2859, that is also the casualty department admission document.
There is no doubt that this patient was admitted on the 8th. That is a fact.
As your ladyship pleases.
So I don't know. The problem is I don't know what Mr. Pichela is trying to say, because these notes that you have just referred him, the witness to, if I look at the notes again, let me just go back to 861. Unless if I don't understand what he's trying to say. The page was 2861.
Yes, that was the initial page that I referred to. Then
yes, but the one that talks about a Tuesday of the 2nd.
That's correct, my lady.
It's page
2861, my lady.
Yes. 28 years old male patient, chronic patient from unknown hospital. Caregiver says she found the patient like this when starting to work on Tuesday, the 2nd of the 8th, 2016.
As your ladyship pleases.
Mr. Pichel, I'm going to allow this question. Can we let the witness answer the question, please?
Yes, court pleases.
Continue.
Okay.
Thank you, Professor.
So based on those notes, there would be two aspects that I would have been concerned about. The first one is the decreased level of consciousness, which was indicated by the Glasgow Coma Scale of 9 out of 15. And the second aspect that would have concerned me is the finding of bilateral crepitations in the chest.
Professor, and your concern in those two respects relevant to the delay, is there any significance in that?
Well, I think the depressed level of consciousness could have been a post-seizure or post-ictal state, and may have been an indication that the patient's epilepsy was not well controlled. The crepitations in the lungs could indicate that the patient had pneumonia at this point. And if that was confirmed, then appropriate intravenous antibiotics could have been initiated earlier. But the crackles can be due to other causes as well. The crepitations can be due to other causes, but it may have been an indication of pneumonia being present at that time.
Thank you. Thank you, my lady. I have no further questions.
Thank you very much. I'm going to close, I think. As I just asked as to whether is there any other person who would like to ask questions to this witness based on the questions by Mr. Van Bergen. Okay, I'm going to excuse the witness.
I want to ask a question based on the questions by Mr. Van Bergen.
Mr. Pina?
May it please the court, my lady. Say for the sake of clarity, I have no questions of the learned witness. Thank you, my lady.
Okay, so can I ask Mr. Pichel?
Yes,
I'm going to limit you. You got your 10. I'm just going to limit you to one question, if possible.
Doctor, on page 2861, the person who is being talked about here is mentioned as a 28-year-old male. Do you agree?
Where are we now?
Page 2861, my lady. It's with reference to a 28-year-old male.
So what is the question now? Are we on page 2861?
Yes.
Yes, you have dealt with this page, and then now you want to ask him whether the person is a 28-year-old. You can't be reading this again. I'm not going to allow that. Just come with your question.
I'm not going to read the whole thing, my lady.
No. But you have dealt with this page, isn't it?
My lady, I'm only going to point out one thing.
Please point it out to the witness. He is well aware of the page. We have been referring to this page a number of times, and it has been read many times.
The challenge is the witness does not have documents in front of him, so I have to wait for him.
The document can be displayed on the screen again. Page 2861.
Yes. There is a reference to a 28-year-old male. Of the same document, on page 2867.
Has the document been displayed? Okay, there it is. Yes.
Now, if you turn to page 2867.
If you can enlarge the screen.
Yes.
Can you enlarge it further if possible?
Yes.
Yes, this was also read into the record. Continue, Mr. Pichel. I want to hear before we go anywhere.
Yes, now there is reference now to a 27-year-old male being admitted on the 8th, 2016. Do you see that?
Yes, I see it.
Are we talking here of two different people, or do we think we are talking of the same person?
Miss Mary, just before the doctor answers.
I'm going to object. These statements were provided to the doctor as the same deceased. Now, Advocate Pitlela wants the doctor to comment whether it's a different person.
Yes.
I would submit this question should not be allowed.
Even then, Mr. Pitlela must understand you are not in the criminal court now. It seems now we're in the criminal court.
No, my lady. The only thing
This
that I
document,
wanted
you presented this
to the
document
witness.
previously, and there was no question whether this relates to the same person or not. Now suddenly it relates to different people. No.
No, my lady. What your leadership is failing to see, and which is what I'm trying to show, is the fact that it could not have been two different people, but the ages of this person are recorded as 28-year-old by one person and again as to a 27-year-old.
We know
which
for
we
the
can
fact
simply
that
say,
Mr. Chaba was admitted on the 8th of, or at the hospital on the 8th of August 2016. And that is what we have on record.
yes, and now what is recorded here, we also know for a fact that his age was 28 and not 27.
Okay, that is something else. Will deal with that. If you want to argue that, you can argue that in your argument.
And the only point that I wanted to make to the professor is that it is possible that even in completing this type of medical records, one can make mistakes in terms of recording ages and dates. Would you agree, Prof?
Sorry, my lady, to interrupt.
Yes, Mr.
I had my hand up.
Okay, I just thought you were waiting for your turn. That's fine.
Sorry, my lady, I concur with my learned colleague, Miss Marriott. Mr. Pislela had the opportunity to cross-examine. He introduced these particular documents. He cross-examined on the documents on the foundation that the information was correct and it was recorded correctly. At no stage was there an indication that there's a discrepancy of any nature whatsoever, my lady. And for Mr. Pislela now to request a second bite at the cake is not admissible, my lady, with all due respect. And he's bound to the cross-examination.
Thank you very much.
Thank you,
Mr. Pislela, I'm not going to allow that. I think I've already said that. Thank you.
My lady, the point that the thing I was not saying, I was merely pointing out one thing, and before I could even start on what I'm trying to do,
which you failed to point out.
Lady, objections came even before I could ask a question. Because the point is, and that is the point that I want to put to the prof, and that is the one question that I wanted to put to the prof. It's a proposition to the prof to say, here we see a recording of a 28-year-old. The person is captured as a 28-year-old.
I think, Mr. Pislela, I'm going to stop you here. I heard your question, and when the objection was raised by Ms. Marriott, the question was already clear. I'm not going to allow this line of questioning. Thank you very much. Mr. Pina?
May it please the court, my lady. Sorry, my lady. I had no further questions to the witness. Thank you, my lady.
I thought you said say for clarification. Okay, that's fine.
No,
on that basis, I'm going to excuse the witness. Thank you very much, Professor. Thank you very much for your evidence. You are therefore excused.
May it please the court, my lady.
As the court pleases.
Ms. Hassim?
Thank you, my lady. I just wanted to raise with the court the question of the plan for next term. So the plan for next term and the witness lineup. So it need not be recorded.
Yes, I just want to check. I don't have my directive with me now. When are we starting? Is it the first week?
We said we would begin on the 19th of April.
Is that the first week of term?
No, second week.
It's the second
week.
It's the second week of term.
Okay. Yes.
So, my lady, I just wondered whether before we break for this long period, whether we can agree on maybe a case management meeting to take place maybe 2 weeks before the next session begins with this court, so that we can have clarity on which witnesses will be coming on which days, so that we can plan accordingly.
Can we first hear from the evidence leaders if that cannot be established now? And whether, if not, they can establish that before we resume?
My lady, if I may, I'm trying to get hold of Ms. Cassandra Chambers because Mr. Sibara indicated that they do want to cross-examine her. Unfortunately, it seems she's on holiday, and I left a message on her voicemail to contact me. We will try to get hold of her, to have her testify on the 19th when we resume. Unfortunately, we are not able to proceed with the rest of the witnesses before Dr. Talatala has finished his testimony, and that he will only start testifying on the 25th of April. So at this stage, the only confirmed information is that we are going to try to get hold of Mrs. Chambers before the 19th and ask her to be available on that day. And the next witness is Dr. Talatala. Thereafter, we will follow Dr. Talatala.
Do we know, before we close that one, do we know the condition of that lady? Mavis? No, before Mavis, Miss Ndlovu, the social worker.
I still don't know, haven't had any information regarding her.
Miss Mjerere?
Yes.
I can see I've noted your hand, Miss Pitlela. Mr. Pitlela. Miss Mjerere, I've indicated that we are not going to start with those witnesses. Mr. Pitlela, can I first hear Miss Mjerere?
Yes, please, the court, my lady. I've spoken to my client, and she indicated to me that she's feeling much better. And I'm hoping that, as discussed previously with Advocate Lade, she will be able to testify on the second term, my lady.
But can it be this second week? Because obviously Ms. Chambers won't take the whole week. Because I take it that from the 19th, it's going to be the whole week. We can't just sit 1 day or 2 days and then we lay to rest. Mr. Can you consider scheduling her, Ms. Ndlovu, in the week, in the second week? Either from a Wednesday or Thursday and Friday, Mr. Lade? Can you please discuss that with her?
I would appreciate it if Ms. Ndlovu can be available from the 19th, because we still don't know what the situation is.
Yes, can you please discuss it, and you can send us emails? Is it necessary to hold a case management meeting?
No, I don't think so, my lady, because after these two witnesses, Ms. Ndlovu and Dr. Talatala, we're going to proceed with the normal sequential list of witnesses
But then we still have an issue with regard to Mavis Mohosinyane. But this is going to take until we hear from Mr. Pitlela, because now
Mavis is part of. She's part of the Mosego and Takalani team.
But what is the problem? Why can't she testify now? Is she waiting for legal representation also, or what is happening?
It seems like it, my lady.
Can I come in, my lady?
Before you do that, can I hear Mr. Pihlela first? I think he wanted to say something.
Yes, my lady. I was suggesting that we can also fill in one of the slots with Mr. Nofile.
Come again?
Mr. Nofile, my lady, we're also waiting to cross-examine him. I think he testified before.
Yes, remember Mr. Late. Mr. Pihlela is raising another point. I think Mr. Nofile.
I think he was cross-examined by my learned friend.
I don't think so.
He testified.
I did not.
Just a second. As far as I can recall, he...
Did he not testify before Professor Tintinger?
I'm checking my notes. Just a second.
No, I did not cross-examine him. I think I had withdrawn at that stage because I did not have instructions, and it's one of the employees.
Just a second, Mr. Pihlela.
Please.
Yes.
Yes. That was that after his evidence, that was when Mr. Pihlela indicated that he was withdrawing. So he has not been cross-examined by Mr. Pihlela.
I'll arrange with the investigating officer to have him available.
Let me just make a note, and I'll also be going through the records. I don't know how far are the records up to now, but I will have to check so that you can receive the records as soon as possible.
My lady, the second thing was
can I first make a note, Mr. Pihlela? We've got Sandra Chambers, Cassandra. And then there was also Missing Glove with the social worker. No feeling. Yes, you can make your point.
Yes, my lady. I just wanted to give feedback with regard to the application for legal representation.
You did that in the morning. Remember, I gave you the time. Is there something else now which came in during the day?
I got an update.
Okay.
While the court was in session. And indications are that the decision will only come after the CCMC has said on the 6th of April. So we should be able to receive an indication after the 6th of April.
Okay. Thank you very much.
God, please.
Can we then adjourn the proceedings? Then I'll, after adjourning, I'll have to hear what Miss, is it Miss Mokojo, or what did you want to say?
So, my lady, you were asking about maybe Smokosinyana. I just wanted to remind you that she's one of us, the three of us.
I know that. I was just wondering, why can't she just testify? I know that, and I think you have made your point previously. Okay. I don't understand why she can't testify, but if that is what, but this is now delaying our proceedings. I just cannot understand why, but if that is how you prefer it to go, that's fine.
My lady, may I just, for Mr. Pishlela's advantage, I've arranged for Mr. Nufile to be here on the 19th.
And then from there, you'll check with Ms. Stephanie Ndlovu.
And Cassandra Chambers, yes, my lady.
Okay. you. The proceedings are therefore adjourned to the 19th of April 2022.
May it please the court, my lady.
As the court please, my lady.
As the court pleases, my lady.
As the court pleases, my lady.
May it please you, my lady.
Thank you.